That's such a perfect prelude to our next discussions on intergenerational health, prosperity and welfare. And I'm so delighted to welcome Denni Fishbein to talk about the proposed Decade of the Child. Denni is founder and co-director of the National Prevention Science Coalition to Improve Lives, and she's a professor at the University of North Carolina, Chapel Hill. We're also thrilled to welcome Denni as a new Nova Scholar this year. So thanks, Denni. Over to you.
Outstanding. Okay, so hi, everybody. It is an absolute pleasure, and I am so inspired and deeply moved by the previous presentations. I'm speechless, but I'll talk anyway. So Susan has graciously asked me to talk about the project NOVA is supporting to advance a national research and policy agenda that promotes a holistic developmental primary prevention approach to whole child health and well-being. So what this does is bring into play the body of research that many have talked about so far and will in subsequent talks, and operationalizes it so that we can act at a policy level to try to scaffold child development and health. So I'm working with Christy Bethel and a team of experts and organizational partners to leverage the research and policy experience and tools developed by the National Prevention Science Coalition to Improve Lives. And when I'm done, I'll put a link in for our organization so that we can focus our advocacy on the imperative that we nurture whole child health and well-being. So what we're doing is emphasizing the need to address those conditions that give rise to the adversities that can harm children's physical, emotional, behavioral, social, and academic development, and also to promote conditions that enable children to thrive and flourish in all of these domains. And Christy earlier defined whole child health and well-being for us, so I will get right into how we plan to move closer to meeting those objectives on a population level. So our work is guided by findings and best practices generated over the last 40 years by prevention science, which has basically focused on two lines of defense. And yes, the numbers are switched intentionally, but first, so prevention science has shown us how to mitigate the impacts of adverse conditions on development and health. The brain is plastic in childhood, for better or for worse. For worse, adverse conditions on development can impede the brain, the way it develops, and in turn, behavior and social development. But for better, there are a lot of evidence-based strategies that have been developed and well tested, and nurturing conditions that we know can improve overall outcomes throughout the life course. But then I go to number one, because for me, at least, that's the first line of defense in our playbook, and that's to reduce the risks, the prevalence of those risks in the first place, so that children are not exposed at the outset. The science suggests that we can avert pathways away from these negative outcomes, including systems involvement, that we can break the cycle of intergenerational problems, and we can foster health and well-being through practices that affect each of the influential conditions that are shown in this figure. So there are huge opportunities for prevention experts to collaborate with the federal government, with states, with local officials, with healthcare professionals, and service providers to integrate prevention into their practices and improve the overall health of children. So there's a lot of knowledge, but despite this knowledge, prevention science really has not reached the government and the public sectors. There's very little understanding of what prevention is, or even that there's a science to prevention, and then its value added to public health policy. We know that child health is critical for population health, and yet investments in research and systems improvement are extremely low. And for that reason, these sectors that I have here, healthcare, education, and so forth, are relatively unaffected by prevention science. So basically, in short, what we know is not being translated to what we do. There is potential, though, for population level impacts if we broadly scale up evidence-based strategies. the changes in policies that have been shown to improve outcomes, and actually the normalization of the principles that underlie prevention so that we are living them in our daily lives. And that's why I cited these two articles here on a culture of prevention. So we feel strongly that it's time to act. We want to focus on those factors that influence child development that can either increase or reduce risk for mental, behavioral, social, and physical health problems, which are currently at unprecedented levels in our society. And our Decade of the Child initiative is intended as a first step in that direction. What we need to do now is more applied research so that we can inform a blueprint for a national policy agenda that effectively prevents these harms and increases exposure to positive experiences. So this is why I slipped up and said the Decade of the Brain, which I was involved in many, many years ago in the 1990s. What we want to do is invoke a similar process that was used for the Decade of the Brain successfully, and working with a team of experts to first encourage NIH to invest in a trans-institute applied research agenda that prioritizes whole child health and well-being, given the role it plays across all disease states. And this is a step that we have already taken with NIH. We also want to motivate congressional members, especially Appropriations Committee members, to carve out funding for NIH that will provide that blueprint that basically supports children's needs through legislation, through agency level practices, and environmental change. We also want to approach the incoming administration about a proclamation that supports this bipartisan agenda, again, all following the Decade of the Brain process when we're looking for alignments along those lines. And then we want additionally to engage in a public education campaign so we can increase awareness of the importance. So we will also ask Congress to evaluate their own policy priorities and identify opportunities to advance a child-focused policy agenda. And if we can expand on each of these policy areas, we could really make a key difference with, the child tax credit as an example of what we can do to reduce adversity and improve health and well-being. So getting prevention into the drinking water of every community, along with policy change, systems transformation, and a supportive infrastructure, it is critical for whole child health to become part of the public zeitgeist. With the public support, we feel we can make some traction in moving the needle at these levels, at all of these levels, to embrace the concept of whole child health and institute policies that are known to improve the outlook for all children. And I will end there. Thank you very, very much.